Things I've seen in the emergency room, ER nurse edition. Herpes simplex virus, or HSV. There are two types of HSV, type 1 and type 2. HSV type 1 is typically oral labial, or more commonly known as cold sores. HSV 2 is genital herpes, and it is commonly transmitted via oral, genital, or anal sex. So about 80 to 90% of the population test positive for antibodies of HSV1 because it's usually transmitted from a mother to their child, or a sibling to another sibling when they're kids and they kiss their child or their sibling. However, HSV2 is typically characterized by very painful yellow or green filled blisters in the area of contact. And usually patients at their first outbreak will also have flu-like symptoms, muscle aches, painful urination, pain during sex, or unusual discharge. It is tested via a swab of the lesion, and because herpes is not curable, and they'll always have it. So once a patient tests positive for it, they will always have herpes, and they do prescribe antivirals, but it depends. For example, if a patient, after their first outbreaks, in that first 6 months, if they have many outbreaks, we'll sometimes recommend antivirals every day. Otherwise, if in that first 6 months after their initial outbreak, they don't have as many outbreaks, we'll only prescribe antivirals when the patient actually does have a outbreak.